Welcome to the Learnskin podcast with Dr. Raja and Dr. Hadar, where they discuss all things skin. Skin is fascinating because it affects us in so many ways, like our health, psychology, and how we connect with those around us. This podcast delves into the art and science of skincare. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Levtov are board-certified dermatologists. This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of Learnskin. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional. This podcast does not constitute medical or other professional advice or services.
Hey Raja, how are you today?
I'm doing pretty well, Hadar. I think it's podcast time.
Yes, it is. And today I think we are all in luck because I've always wanted to know what happens behind the scenes or behind the creams, if I may say so. And now we're going to get a look behind the creams at what happened in a compounding pharmacy.
Yes, and to start with, let's welcome Natalie Gustafson, who's a PharmD. Welcome, Natalie.
Hey, Natalie, welcome.
Thank you so much. Thanks for having me.
So we're pretty lucky. This is going to be a treat. Natalie is a compounding pharmacist. She works a lot with the integrative community. She's up in Portland. I can't think of any place that's more integrative than Portland, right next to the National University of Natural Medicine. And she's been a speaker at all kinds of events, whether it's the Oregon Association of Naturopathic Physicians or the Central Oregon Health Council, Hawaii Doc Talks, British Columbia Naturopathic Association. So she's North America's compounding integrative pharmacist. So we're pretty lucky to have you here, Natalie, and we're looking forward to learning. I know I'm probably going to learn a ton that I didn't know before.
Oh yeah, I love talking about compounding. It's definitely my passion to share the information, especially for the ability to do integrative. I'm so impressed at the way you're approaching dermatology and taking the best of both worlds, and compounding can really help with that, which I think is great.
You know, as they say, magnetism kind of brings people together. So I'm just going to start off by saying, Natalie, we've pulled you into our Integrative Dermatology Symposium as a speaker, and, you know, we're looking forward to that talk, but we can jump into some compounding topics.
I think maybe we can start with some fundamentals. Maybe you can tell us about what's compounding and what is its advantage compared to just normal prescription?
Absolutely. Well, and certainly in dermatology, there are plenty of commercial prescriptions that work great and are excellent tools for use in that. Compounding really comes in when you're trying to expand past that. So either integrating some of these natural substances that maybe wouldn't be in a commercial product, combining ingredients really to help with patient adherence. So instead of applying multiple creams, maybe they can do one. Maybe we're treating more than one condition even. I have a lot of women who present with acne as they're going through menopause, but they also want an anti-aging component to it. So being able to combine those type of things is great. It's really for either specialization or something that isn't available is when compounding really comes into play, or honestly, really tough cases. I get the calls where they've tried everything commercial, they've tried everything they can think of, and they're just stuck. And we've really helped some amazing cases of people who've been miserable forever and with a unique kind of combination have been able to really pull them out of it, which is really exciting.
Maybe this is an obvious question, Natalie, but when you do compounding, are you compounding only for topicals or do you do oral compounding as well?
Oh, sure.
Hey, it's not obvious. I was thinking the question
No,
myself.
it's a great question. No, you're totally great. Absolutely. It's everything. So everything from oral to topical to rectal, vaginal, even injectable. So it's every range of thing. I do a lot of sublingual things too. So a really wide variety. Pretty much if you can think of it, we've probably done it.
Amazing. Well, one of the questions when it comes to integrative compounding is that you're taking probably a lot of the standard available FDA approved medications that are around or at least GMP produced. And then you have the naturals as well. Mm-hmm. Can you talk about what naturals are allowed or not allowed to be used? Because I used to think anything was allowed, but then I realized there's actually a list. And lo and behold, I just found out kojic acid got removed from this list. So can you talk a little bit about this?
Absolutely. This has been a big area for confusion for lots of practitioners. And the reality is it's confusing for a lot of compounders too. There's been a lot of changing rules over the last couple of years, and it's hard to keep up with, honestly. So you may call one compounder and they say, oh yeah, we can still do that. But they maybe didn't hear that announcement, like kojic acid is a great example. It's not allowed to be an active ingredient anymore. So it's not that we can't necessarily use it, but it's tricky. It gets trickier because how do you justify having it in something if it's not an active, not your main purpose for it? And this has happened with a lot of natural substances. So things are under review right now and trying to determine what we are allowed to compound and not. And so a lot of things have gotten shifted from a list that everyone kind of assumed, oh, it's natural. It has this USP monograph for, dietary supplements. We're good. But the interpretation federally has been if it doesn't have a drug monograph, that we shouldn't be doing it unless it's on this list. So that's what has created a lot of the confusion. On top of that, we also have restricted access sometimes to natural substances. So for instance, in my state, if I am to buy something natural, it has to come from a licensed wholesaler with my board of pharmacy. And a lot of times natural substance places don't do that. They don't think about needing pharmacy registration. So I'm more limited in what I can get even from that perspective.
So let me ask a slightly more detailed question on kojic acid then, because you just said kojic acid can't be used as an active ingredient.
Right.
Does that mean that you can still incorporate it into compounds if there is something else that's working as the active and this is going on as an adjunct?
This is the weird gray area. Some will say yes, some will say no. So it is now listed as what's called an excipient. So excipients are additives that you put in something. So let's say you have a tablet, you have the active ingredient, but you need some kind of filler, right? So it will have, say cellulose or lactose, a lot of times commercially, will be your filler for that. So it basically means a non-active substance. Something like kojic, it's a little gray, right? Because how do you argue, oh, I'm just using this as an additive? What sometimes some people are doing are saying, okay, we have this base that has, let's say kojic acid or hyaluronic acid, something like that in it. And then we're going to add some actives to it. And we're sort of waiting and seeing how that goes, which I know isn't like an exact answer, but part of our world too.
Yeah, no, actually, it's a little comforting to hear that there is some gray in all of this.
Yeah.
Hadar, sorry, I'm monopolizing the question. I do want to follow up on this and say, so is every natural that is allowed to be used being tied to a use as an active component?
Right now, for the most part, it's definitely the big area where everyone's going back and forth on what you can argue, like, let's say it's a vitamin, vitamin A and E and stuff. Obviously, a lot of creams come with that in it. So, where does that distinction happen? And that's definitely like a big head scratcher for most people. And this is an area where a lot of compounders don't even know, because unless they're following that kind of thing, it can change. I mean, I've created lists for my pharmacists so that when people call in and say, hey, can you make this? They're like, wait a sec, let me reference this. Oh, it might change, but okay, yep, right now we can. So, because things we used to be able to do, we can't now. So it's really strange. It's a very strange world, honestly.
Well, thank you, Natalie. I think that was as clear as mud. But
Yep.
You actually took a somewhat complicated issue and made me realize one thing. I need a trustworthy pharmacist on my side. So that leads me to my next basic question. If compounding can be so powerful and so useful, and there are some gray areas and it keeps shifting about, how do practitioners coming out of the gate or practitioners who never used compounding before get started? Where do you find a good compounding pharmacy? How do you go about doing this if you're not in your state? Obviously in your state, I'm calling you, but how does one start?
Thank you. Yeah, no, absolutely. And I really strongly encourage people to find a local place if possible. Obviously, if you're very rural, that might not be an option, but try to find as local as you can, because that means you can tour the facility. You can really create relationships with those pharmacists, and you really want to be able to ask like clinical questions. Can they answer your clinical questions? Can they explain a mechanism of action to you of the medication? If you either came in or let's say you had a question about quality control, they can explain to you the different elements that they do, the different testing that they do, the training that they do. They should be a full out laboratory, full garb, hoods, all that kind of stuff. If they don't have that, I definitely don't recommend using them. You want a place that does that. There are places you can go to look like for accreditation and different things like that. Everyone, it's not like a black or white, like if you're not accredited, it doesn't mean you're not good. But if you have done accreditation, that does mean you've gone through extra steps to have a third party come in and validate your processes. So that can be a nice way to check for that. And so not everyone has done that. In fact, I'm in the process actually of doing it now because our state rules are changing. So I'm getting that in anticipation of that. But definitely like going through that process, I'm like, oh yeah, this is a nice way to know. So that can be one of the things that's helpful for sure. But definitely ask questions, create like a good relationship. I think that's super critical.
So Natalie, I know what some of the compounding pharmacies in our area, but it seems like you need even more specialized knowledge when you go to this level of being integrative, especially with the naturals, because what I'm starting to understand is that there's some specialized knowledge in understanding what can and can't be used. Is there a central database that people or practitioners can look at to find out who has that knowledge base, or can we assume that any pharmacist should have that knowledge base?
That's a great question. There is not definitely there's not a central database. That would be awesome, but definitely have a couple questions that are pretty integral to that integrative practice and ask. I would like to say every pharmacist can answer those kind of things, but certainly that may not be the case. Certain compounders really specialize in other areas, depending on the needs of their community, or, some do only veterinary, some do, focus on sterile, some focus on hormones. So absolutely, it's worth asking what kind of training they've done in that, and maybe ask a couple, like, they're on the hard case or something, see if they can come back with some good options, find out what kind of evidence-based medicine they can come back with. I am really careful when I make recommendations to let people know, either have I only seen this clinically? Do I have a good study to back it? Are we just kind of trying it out? Is it something that I've really seen repeatedly? So it's nice to have them be able to answer those kind of things.
Thank you, Natalie. That was very informative. In fact, for many dermatologists, I think the analogy of having your own pathologist is relevant. We are trained in residency, at least in Western dermatology, to really have a working relationship with our dermatopathologist. And I know that I have a working relationship with my compounding pharmacist, where I was surprised to the level of knowledge and citations that we were discussing. So certainly, thank you for giving us this additional background. And I think now that we have these basics kind of laid out, perhaps we can jump into a few examples that are relevant to integrative use of compounding in integrative dermatology. Can you perhaps take us through one or two examples that are very popular in your pharmacy?
For sure. Absolutely. I certainly do a lot with acne, which I'll mention because I am actually not doing an acne case in my talk. So I'll do a different one so I don't give all the goods away. But yeah, so let's say acne. So I have a decent number of naturopathic physicians, especially in this area, who have said, hey, I have patients who are coming to me. They don't want to do the traditional options for that. What kind of things outside of this could you look at? And so often we will do things like in acne and rosacea, azelaic acid. So there's a commercial product for that. It works great. But we can really boost that by adding other things in, like even if you want to go like the drug route, like you can add metronidazole into it. But let's boost it with something like niacinamide, which we know is going to pull that redness out and calm everything down. I've even added ivermectin in for like really resistant rosacea cases on that. In the acne world, I do a lot with hormones. So I see a lot of women who are going through that androgenic acne, one of the most common reasons for it. And so we will work with them even just on the hormone side, like balancing that. And then we'll do a topical to kind of pull some of that oil production down, calm all that down. You can do everything from like green tea to saw palmetto, vitamin C, zinc. There's all kinds of things that you can do to kind of reduce that while you're kind of getting everything else balanced.
Natalie, were you in Sacramento today? Because it sounds like you might have been in my clinic. Because I was literally talking to a patient. And, everyone always says I literally was a patient. And we were just doing azelaic acid and mixing in niacinamide topically.
Perfect.
And
I love that combo.
No, I think that combo works really well for folks, even if they have a bit of skin of color too, because it helps to also even out the tone beyond just having the effect for rosacea, for acne rosacea.
For
Very,
sure.
very interesting. Now, where can people look at what are the naturals or what are the other elements that can be included into a compound? Because, there are the FDA approved medications like our compounds like azelaic acid, but what about if they wanted to do green tea or vitamin C? Is there a list that they can choose from? How does that work?
Yeah, so most pharmacies will have a list of common combinations that they do or common ingredients that they offer. So I always recommend checking with them to see like, hey, what's really popular there? What are you seeing like really good feedback on from your patients? They almost always have that. Some compounders like me, I also give a lot of presentations. So sometimes I even have a talk that I can share with them on here's the research that I found on green tea or the active component of green tea, one of the catechins called EGCG. So there's lots of great data on that from everything from anti-aging to scars to psoriasis and eczema. So asking for that kind of material is really helpful. Even some compounders have access to even like more standard databases where they can download and show you, oh, hey, here are your list of options for that. So definitely ask. That's a great thing to ask about.
Thank you. That's a great example. And I'm wondering, because this question comes up often, how do you choose the base? So let's stay with the acne example for a minute. How does one choose the base in which you mix this?
Absolutely. So that comes down to a few things. One, I'll check to see, is this patient going completely all natural? Do they need an all natural cream base? Maybe they don't want anything that could have a chemical in it, so that's the first step that I check. The other is there are specialty bases that we have access to as compounders that are specifically designed to deliver those active agents better, reduce redness, reduce irritation, kind of balance out, especially if you're adding things like salicylic acid, glycolic acid, things that could be potentially a little irritating to the skin. So we have specific bases that are designed to kind of mellow that out. And we'll obviously always offer those kind of options. So a lot of places will have their favorite go-tos for that.
Well, Natalie, one of the things that I've always wondered about, especially because we're talking about topical bases, what about orals? What are you able to put together on orals? Is it anything like if I wanted to put a probiotic with some sort of another oral supplement, whether it be something like L-histidine or whether it be some sort of herb? What are the rules when it comes to oral compounding?
Absolutely. It's similar to topical. It's the same access issue that I mentioned before. So assuming you can access all those, you can compound. Some places have rules about cosmeceuticals and other topicals, but then anything oral has to be by prescription. In my state, everything is by prescription, even if I was only doing over-the-counter or herbal supplements.
Oh, really? So even for cosmetics, like if it's truly aimed at like the cosmetic appearance of the wrinkles or whatnot, you still need a prescription for it.
Yeah, in my state, but that definitely varies.
Got it. Yeah. And then speaking of states, say I'm in California and I wanted to work with someone in Washington or Oregon. Do they need to have a license in California to be able to deliver medications to patients in California? How does licensure work when it comes to compounding pharmacists?
You need to be licensed in whatever state you mail into. And so you may know this, California is tough. They have a tough pharmacy board. They enacted rules that haven't gone federally yet a few years early. So they're really challenging to be licensed in if you're out of state. So not a lot of out of state places are licensed in California because of that, just because there's a lot of steps that you have to go through. I think I looked like one time and it's like a 600-page like application. So it was pretty involved.
Not your grandma's application to pharmacy.
No. Yeah. And it's great. I mean, it should give you some confidence, in the compounders down there because they're working hard. They're having to really be on top of, testing and facilities and training and all that. So they're definitely working really hard to do everything the right way, which is great. But yeah, so you might find some challenge with that. I'm trying to think a good way to find out if someone was licensed, because it's not like you could just look me up and go, oh yeah, she's licensed in my state. There's no easy way to do that. You'd have to log in and look at licenses and stuff, which that sounds like a pain.
It sounds like I'll probably call you and ask you.
Yes, I think that would be the easiest for sure.
Well, Natalie, we've been talking a lot about compounding and what we can do and how we can put this in or whatnot. But what are some of the errors that you've seen when it comes to compounding and prescribing? Because that's something that we definitely want to try to avoid.
Absolutely.
Yes.
Yeah. So it's interesting. Probably the number one source of errors are electronically submitted prescriptions. Everyone wants to be able to do an EMR, e-script, but the way the system is set up, it's challenging to select all the ingredients that you want and make it exactly how you want it. A lot of EMRs are set up kind of strange. Like you might have to just choose one of the powders and then everything is, in a weird weight and you have to do a lot of adjustments. So I definitely think that's probably the number one type of prescription I end up calling on because the system left some piece out or there's a contradiction between the quantity listed and in the SIG, they might say, actually only dispense this. So we have to reconcile that if that happens.
Are we able to put in a miscellaneous prescription and send that to you?
Absolutely. So many EMRs have either like non-specified compounding or miscellaneous. Absolutely. Many allow that as long as it's not a controlled substance, which obviously most of the things you're prescribing are not. So obviously if it's controlled, you don't want to do that. But if it's not controlled, that's totally fine to do. I have many practitioners that do that. And in the SIG or med note, will write out exactly what they want for that. But sometimes, let's say in that SIG for the directions, they write out the name. Well, they might then forget to actually give me the directions because there's so much in there already. So that's the type of thing I tend to see missing. We have to remember these are wide open. So it's not like a commercial product that only comes as a certain size or a certain strength. We have just this huge plethora of strengths and sizes and all the stuff that we can do. So we do have to be really specific with that stuff, which not everyone's used to having to be to that level, which makes sense.
So I don't know how the regulations work in various states, but would you suggest maybe creating a pre-made menu per practitioner, knowing what the practitioner likes and have that practitioner add as a menu that's ready, and then that reduces the amount of errors and makes it easy and understandable for the pharmacist as well?
I think that helps so much for that. Those kind of things, I can tell which providers have done it a lot and have put that in. And absolutely, that reduces the number of calls tremendously for that, makes things go through much faster and smoother. So we can call that patient and get ready, because unlike a traditional pharmacy, we call every patient. We make sure they want this size and this way and what packaging and what they want. Everything is really tailored to them. So we're checking in with each one, and it's nice to be able to get that through quickly. So you guys are looking good. We're calling them right away, and they're going, oh wow, they already call it in, and I'm gonna be able to get this, because it takes a little bit longer to make, right? So we want to get that process through quickly so that they're not feeling impatient, because people are excited. They want to start these creams. They want to feel better. But we also need time to make it because we're mixing every component in a lab.
Right. And one of the things I like about these pre-made menus is that I can update them, and that creates sort of an ongoing conversation between you and your pharmacist. So you can keep up with trends. For example, CBD, is that a hot trend right now for you?
Oh, CBD is also a very interesting regulatory subject. So it depends. Well, it depends on the place and the state. But like for me, I'm pretty conservative. And since federally it's not allowed, like in a pharmacy, I don't do anything with it. But I certainly live in a state where it's completely legal, and even marijuana is legal. And so I work with a lot of patients who often will be using that like in addition to whatever I'm doing. So we'll figure out, okay, apply this one first, then this. Oh yeah, you can mix that with that. But I'm restricted and pretty cautious with that because the federally, it's definitely a strange area. Lots of debate.
Well, we'll take you off the hot seat for now, and I think we will. Thank you for your time. I cannot believe there's so much more to learn. I've been sort of taking notes as we're talking, and I'm sure our listeners as well are taking notes and eager to hear more. I want to thank you so much for your time and expertise.
Thank you so much for having me. This was really fun.
Thanks.
Thank you for tuning in with Dr. Raja and Dr. Hadar. This podcast is brought to you by Learnskin, leaders in integrative dermatology education. Visit learnskin.com/podcast to explore our many programs. Subscribe today and never miss an episode.